strategic projects for the West Australian Alliance to End Homelessness. And thank you for joining us this morning. We actually have quite an audience, but they're all on Zoom. So hello to our Zoom audience and thank you for joining us this morning. Firstly, I'd like to start with Nala Kadich Wajak Nunga Mort, Kayan Kadik Nijabuja. And we acknowledge the Wajak Noongar people as the original custodians on the land we meet and pay our respects to elders past and present. Just a little bit of quick housekeeping. If you haven't been to this facility, the ladies and gents are past the lift. The men are on the right and the women are on the left. If there's an emergency, the local staff here will direct us outside. And in terms of COVID, we are seeking to keep this as COVID safe as possible, and we encourage you to use masks. We have masks here available and sanitizer, so just encourage you to remain well. Okay, so today launches our update of our End Homelessness report for the West Australian Alliance. When the Alliance came together in 2016, one of the core principles that we agreed to was to be evidence-driven. And when we released our strategy in 2018, one of our 5 pillars was data, research, and targets. So since 2018, each year, we have committed ourselves to updating and understanding what is the data telling us in the form of a report, and that is the Ending Homelessness in Western Australia report. And so by 2019, the Centre for Social Impact at UWA had developed an outcomes measurement framework to help evaluate our progress and release our first report. Alongside and within that report, the Alliance set itself 9 targets to work towards. Now, these targets sought to reflect what does an effective homelessness system look like when homelessness is rare, brief, and one-off. So they were ambitious targets. Again, each year we have updated the progress that is being made towards achieving these target aims, called the WA Alliance to End Homelessness Outcomes Measurement Framework Dashboard Report. So today we will hear the update for 2022. Since the first report, CSI UWA through Paul Flatau has undertaken this work, and we've had the privilege to hear and reflect on the evidence we've been able to gather and present by Professor Paul Flatau. So as you know, Paul has been one of the founding members of the Alliance since 2016 and has been key in doing research across Australia on many aspects of homelessness, health and homelessness, the cost effectiveness of homelessness and homelessness support. So his research is quite extensive and he's been with us through all this journey. And I welcome Paul now to the stage to present the report for 2022. Thank you, Paul.
Thanks, John, and welcome everyone. I know that we've got an audience of 120 people online, but we've had a good number here as well. And those who are here today will obviously be able to pick up a physical copy of the report. So that's a bit of a bonus for you who are here today. But it is online. And if you go to the West Australian Alliance to End Homelessness website, you'll find the report and of course the dashboard, which we're going to talk about. So it's a great privilege to be here today. But let me begin by acknowledging that we're on Wajak Noongar land and pay our respects to the elders of this land. We will be emphasising at various points the very high rate of Aboriginal homelessness, and that's a very important part of the story. So today what we're looking at is not only the report that you have available to you physically here, but also online. So make sure you, those who are online, download a copy of the report from the website. But we're also launching the first comprehensive community-based dashboard, homelessness dashboard for Western Australia. So the Alliance has moved from a paper-based dashboard to an interactive web-based dashboard. So it's a pretty special deal, and we'll have a look at that as we go through. So as John mentioned, what we've done in the Alliance is set up an evaluation framework. It's quite extensive and discusses and examines what are the key components of an ending homelessness strategy. So ending homelessness is about understanding the drivers of homelessness in the beginning. So we do emphasize those drivers, the underlying drivers that create inflows into homelessness in the first place. And then we examine the current state of homelessness and look at how we can end homelessness that we actually see and move people into housing with support where needed and long-term support in a supportive housing model. So that framework was established, and there are two main things that come out of that framework each year. One is the Ending Homelessness Report, and the Ending Homelessness Report provides this extensive outline of what's happening to homelessness in Western Australia right now. This year, we have a decade of advanced to zero data that we've analysed. So part 2 of the report examines that decade of data, 3,000 people. That's a huge data set, and it gives us a very rich understanding of the circumstances of people and the housing placements that have come from the housing first models in particular, and the systems-based models that have been applied through the Zero Project and the like. And then the third part, we go to the policy environment, and this year we make sure that all of the services and agencies have had a chance to write their own words, if you like, about the things that they're doing. Mike, how are you? Okay, Zoom audience. Oh my goodness, you're up high, aren't you now? Good. All right. So I hope you can hear me online. So when the Alliance developed its strategy, a document that is still worthwhile looking at, I know we're going to update it at some point, but it is really an important document. We set these 9 targets around halving the overall rate of homelessness, but making sure that we end chronic homelessness and no one stays homeless for more than 5 nights at maximum. And we're going to talk about where we're going with that. We also talk about the drivers of homelessness and addressing those drivers. We can't just focus on current homelessness. We must attack the drivers. And then we have targets around collaborative efficacy and making sure that we work well together and measure and do good research. So those targets are something that we are following steadfastly over time. And I'll talk about how we're going with those targets as we proceed. Now, I mentioned the dashboard. So if everyone can get their phones out, go to the West Australian Alliance to End Homelessness website. The actual name of the dashboard is really hard to type in, so it's easier just to go to the West Australian Alliance to End Homelessness website and, sorry? News section. Go to the news section and go to the report, the area, Ending Homelessness report area, and you'll see at the bottom, click here for the dashboard. Now, this dashboard has been developed in a very quick fashion. So it's not on a, if you like, full-blown website, but it is on something that we've created that enables us to do it. And I think you can see most of it on a mobile phone. It's more designed for a laptop. But the dashboard has gone interactive. And so what you'll see when you go to the dashboard is this site. So hopefully you found that site and you can navigate on that left panel across those tabs. And notice what the tabs have. The tabs have just a bit of a background on the Alliance, but also the state of homelessness, what's happening in terms of the state of homelessness, a big section on the key drivers of homelessness. It also has the funding of homelessness services from government, In the report, we also refer not only to government funding, but the issues that agencies are facing around funding. So make sure you have a look at the dashboard there. Then the lived experience voice. So one of the big factors behind that, decades worth of data is that we have thousands of quotes, literally thousands of quotes from people experiencing homelessness, primarily those rough sleeping, about what do they need to be safe and well. And when we think about a lived experience voice, we should be watching and reading and listening to those voices about what we need to do. And we just give a selection of those quotes there. So let's dive into the dashboard. So let's get the dashboard up and running. So here it is, my goodness. There it was. Here it is. Actually, I was told to make sure I look at the screen rather than literally look over here because it's easier. Okay, so let's have a look at trends in homelessness. Ending chronic homelessness. Now, if you have a look at the advanced to zero data, this decades worth of advanced to zero data, what you realize is that we still find that the majority of respondents are over a year in terms of total time homeless. It hasn't reduced, it's stayed constant. If we were working as a system to move people into housing and we kept on asking these questions, it would be of new entrants into homelessness and their durations would be much shorter. What the data tells us is that we have not changed these numbers. In fact, the average duration is still at 5 or 6 years. It's a huge number. So the data is very important in understanding the circumstances. So let's have a look further in terms of trends in homelessness. Yeah, there we go. And let's just scroll down and see how this data works. The census data, as you know, is not coming out till 2023. It is always the last release of the census. So don't get any update. We won't get any updates for a year. But let's have a look at clients accessing the SHS services. And here, the top is those who were homeless on entry. There is a upward trend here, around about 30% since the Alliance started. So the numbers are rising in terms of those homeless on entry. In terms of those at risk, no, they're pretty stable. But we're seeing this increase over time. Now, over here, what we show is what's the change in a status of someone from beginning to the end of their support period. And these are what are called Sankey diagrams, and they show the profile. By the way, you can hover over. A number. There you get. There. You can hover over you can get all the data interactively now. But let's have a look at this. So this is those who are rough sleeping at the beginning of their support period. Where were they at the end of the support period? Well, the biggest flow is rough sleeping. In other words, the majority stay rough sleeping. In fact, that's the biggest flow for all of these categories. So if we look at, for example, short-term accommodation, it's actually short-term accommodation. Couch surfing is actually couch surfing. Where do we see the flows into public community housing? Well, they are there. It's 25% or so, or thereabouts. And there we have it. We have these flows going into permanent housing, but they are not high enough, is the story. So we need to look at that in more detail. Reducing Aboriginal homelessness, we've seen an increase in the proportion. Let me just get some of these graphs up. Yeah. So the rise in terms of clients, by the way, this was the COVID effect. a huge COVID effect occurred where the numbers dropped dramatically because there was a lack of access to services, basically, in that period. There's a short period where people could not get support because the services were in many cases, were closing down too rapidly. But overall, the rise in terms of clients accessing SHS services has been higher for the Indigenous people, and that's a disturbing outcome. Now, I mentioned the funding of homelessness services. We will come back to some of these stories a bit later. But what we see when we look at, these are real expenditure numbers in 2021 dollars, and there has been a rise in homelessness support dollars, but in terms of social housing, from the start of the Alliance, this was a dramatic decline in real terms in social housing spend. Now, of course, the government, West Australian government, in its last budget and in other announcements, has significantly increased in historical terms, a massive investment. That is after, unfortunately, a period of very significant decline. So what's happening is that agencies are being forced into this difficult position where, for those with higher needs, they don't have the social housing placements because of this lack of investment over this last 5 or 6 years. And it will take time for that to come on board. I mentioned the lived experience voice. Let's have a look at that. So here are quotes, as I mentioned, from that question, what do you need to be safe and well? A home, very typical. The home comes out by far the strongest. It is the strongest theme all the time, but it usually comes with other things. A home, and what does a home provide? Stability for my son so he can attend school regularly and participate in normal childhood activities. A safe place for myself, daughter and grandchild. So it comes out as a really significant factor all the time. But it's more than that. You'll see a place that I can sort out health issues, a place where I've got stability and away from violence. Also, a place where I can start to establish friendships, love, belonging. And then also employment comes out very strongly. Here's one, long-term secure accommodation. This is, what do I need to be safe and well? Long-term accommodation, improvement of my general health, find a job. My own place, the ability to deal with problems and move towards employment. The voice of lived experience is extremely strong on employment and jobs. And that is primarily from rough sleepers. So if agencies are not focused on employment, we've got an issue. Advanced to zero, let's have a look at some of the advanced to zero results. I'm going to talk about this a little further, but this is a decade's worth of data, 3,183 people over 10 years, a huge data set. And one of the interesting findings, and we've got a presentation to the Department of Communities next week, is that women on the whole are younger, but virtually on every single indicator, women have worse outcomes than men, virtually everything. So younger women, rough sleeping, are in virtually every respect in a worse position than their male counterparts. And again, that's where the data needs to be listened to, that it is actually younger women who are rough sleeping who are the group that is actually most affected, but men are as well, obviously. Now, if you have a look at some of these results down here, lifetime prevalence of particular medical conditions. So you can see that hovering over. Depression is a huge number, 70% depression, schizophrenia, 20%, and post-traumatic stress disorder diagnosed, self-report diagnosed at 40%. These are very, very, very high numbers. And what the advanced to zero data, 3,000 people, is telling us is that for a significant number of people, particularly in terms of those sleeping rough, who've had a long experience of sleeping rough, we are looking at very high health needs. Average health costs was $28,000. As you know, from all of the work that we've done over a decade, You've got a group that actually have very low health access or self-report, and administrative data backs this up as well. And then you have another group who are very high accessors because they've got high health needs. For those with high health needs, we need a supportive housing model. And in some cases, that will be supportive housing over almost a lifetime or a lifetime. So that's what evidence tells you. So that's the dashboard. Hopefully you've got it and have been able to navigate and check it out. You can hover over anything and you'll get any number that you want. So let's go back to the slides and I'll talk a little bit more about some of the results that we have here in terms of the report. I'll just mention the report again whilst I wait for the slides to come up. Here they are. And we'll just go back to where we were. I'll go back to where we were. So that's the dashboard. And the numbers, as you can, as I mentioned, these are the targets, by the way, the Alliance targets. Are we on track? Well, we'll see in terms of the census, but in terms of the SHS numbers, no, we're not on track. We are well away from being on track when it comes to the latest data on overall rates of homelessness. We are moving away from that track. So here in 2018, we started plotting what would be the line to get us to target with a confidence interval. So just allowing a bit of movement. We are outside that band on the confidence interval already. And we'll see what happens with the census data coming up. And of course, that's the issue, isn't it? The increasing number of people accessing services in the SHS system. We talked about this, the fact that we have a lack of transition from homelessness into housing, but much better in terms of sustaining tenancies. So when we move across, and around about half of those in the Specialist Homelessness Services system are actually not homeless. They are housed, but they're at risk of homelessness. They might be those who have newly entered housing or those who are at risk of homelessness from housing. Do we sustain tenancies? Yes. It's a completely different Sankey diagram, isn't it? You sustain tenancies right across the board with relatively little flow through. In fact, it's a very small number. Unfortunately, of course, that's a number we want zero, but it is a small number that transfer back into homelessness. We also need to recognise the very high rates of regional homelessness in Western Australia. So the highest rates of homelessness are still in the Kimberley, the Pilbara and the Goldfields. So we just need to make sure, and I know here we're in Perth and we've got this massive audience here and then online, but the basic point is that we need to make sure that we've got to focus on the Pilbara, the Kimberley and Goldfields because their rates of homelessness are higher than in Perth. So we need to watch out for that. And as I mentioned, in terms of Aboriginal homelessness, the proportion has actually got over 50% in terms of the SHS system. It's lower in terms of the census data, but in the SHS system, it's at 50%. So we've got this very high number who are Indigenous and who are accessing support services. So it's a very high rate of homelessness, well above the representation. When we look at our needs being met, again, we said 100% of needs being met in the West Australian Alliance, and we're well off track. In fact, we're actually going down in terms of, at the end of the support period, case management needs and goals being achieved. No. What's the primary data of this very poor number? And in fact, a declining number. It is, of course, housing. So because housing is the primary need that is being specified, but there are other needs, and in terms of health needs and violence needs, etc. But housing still remains the biggest need. So if you're not getting people into housing, then you're not meeting their desire. and their goals are not being met. It's a pretty simple story to explain. It's not a story about poor service delivery. It's a story about the fact that their goals are not being achieved. And I mentioned this earlier, high rates of chronic homelessness in the data, and those regional differences which are being maintained over time. If you have a look at the dashboard, we do talk about some of the big drivers of homelessness because we need to address those drivers. We start with housing supply, affordable housing, and so on. But there is a very high inflow from children and adolescent homelessness into adult homelessness as well. And you need to address family and domestic violence. You need to get in very early. So around about half of those who are supported in the service system as adults had their first experience of homelessness prior to the age of 18. And many people will talk about those experiences, some prior to 12, 13, but we'll talk about experiences of 12, 13, 14 as being fundamental. You know, they might have been thrown out of the home or they ran away from home because of issues in the home. And if we don't address those drivers, we are in difficulty. So addressing big structural drivers such as housing, addressing those drivers in terms of family domestic violence and early onset homelessness in terms of young people, many of whom will not describe themselves as homeless. There is actually a gap between when they become homeless and when they recognize themselves as homeless. And some of the researchers, it's a year or two at least, which is an interesting kind of fact. So let's just quickly look at this. This is an interesting one because in terms of affordability, as you know, we actually had a fairly good period in Western Australia. And this is from the rental affordability index, and it was starting to go into, starting to reduce. Now, this is dated data. When we look at the latest CoreLogic data on rents for right now, we are looking at very high rents. So these, when we pick up the next lot of data from this rental affordability index, it will be going sharply into close to the red zone. So we actually did have quite a good period. Rents were pretty, remained relatively low relative to income during that period. This is the kind of result that we need to really focus in on, the social housing dwellings. And the lack of investment in social housing has been a big, important driver to problems in terms of placement into housing. So those Sankey diagrams I showed you of transition would look different if we had had that investment in social housing earlier. So youth unemployment rates are relatively good. There actually has been a decline in youth detainees in custody, but still this massive overrepresentation in terms of Aboriginal youth. And the rate of Aboriginal children in out-of-home care has continued to rise. So we have seen some stabilization, but it's still at very, very high numbers. Family domestic violence, very high. Health is declining, and we've seen this rise in psychological distress numbers in WA. So mental health issues are coming more to the fore. Lifetime use of alcohol has actually moved in a positive direction. And illicit drug use has moved in a positive direction. So we're seeing some benefit, some good drivers on that side. Family domestic violence, after a period of significant increase, did actually dip. So we need to maintain that because this is a huge driver of homelessness. It is a fundamental driver. So we need to address those drivers in terms of family domestic violence, but that's actually a good result there. Now let's have a look at the advanced to zero data in a little bit more detail. And this, as I said, is a decade's worth of data. The results are very, very alarming though in terms of health, and it's good to see the work over this 10 years in terms of homeless healthcare, the work of Ruah Perth, because the data suggests this very high health need. This brain injury and head trauma number, health numbers, and the really high numbers in terms of mental health as well. So these are really, big numbers. 35% reported they've been taken to hospital against their will for mental health reasons. You have these very alarming numbers around mental health, and hospitalization rates for those who are with high health needs, very high. As I said, you actually do have a significant, and this is the result we get in every piece of work. We've got a significant number with very low healthcare utilization. It is wrong to present this story that everyone is the same. And one of the interesting things is when you present, say, a mean health cost, as we do, $28,000 mean health cost, what that doesn't tell you is there's a lot of variability, huge amount of variability. So make sure that you recognize there is huge variability in the system. Not everyone is reporting high health needs. Not everyone is using healthcare services because they don't have to. That's not always the case. Sometimes they don't wish to or don't know about it. But there is then a huge number with very high healthcare access. And that's where we need those models of supportive housing to provide support over time. But in the supportive housing model, we don't just need healthcare workers coming into homes. We need to meet the other needs that have been specified by lived experience. So friendship, how are you working on friendship? How are you working on social interaction? How are you helping people with schooling? How are you helping people in terms of employment? Supportive housing is well beyond a health supportive housing model. It is meeting the whole needs of a person. And a supportive housing model in which you do just simply have, and simply is probably a misnomer, where you have a health worker going into a home is insufficient. It is only one-dimensional. The Advanced to Zero data also tells us the significant number of housing placements, but the majority housing, a temporarily accommodated is not housing, but it is accommodation. We still are looking at temporary accommodation rather than permanent accommodation. But it is pleasing to see the numbers who are getting permanently housed. And when you look at the acuity factor, health need acuity factor, of course, public housing comes out on top because it is very difficult to transition to private rental with high health needs. And this is where the social housing nexus comes in. So we have seen from the by name list, significant transitions from the zero project evaluation, significant transitions into permanent housing, but the numbers are just not high enough. Now, policy settings, we know the WA government pushed through a very good homelessness strategy and did increase funding for that homelessness strategy. Unfortunately, the level of funding that we're looking at isn't high enough, and we can see that relative to other states and territories. The social housing spend was the biggest issue, though. But you look at some of these strategies, so the Housing First initiative, the No Wrong Door, which is coming into fruition. We're seeing some very good programs coming into place. And as I said, we have seen that increase in government expenditure. The social housing, though, is an awful look, actually. And obviously did reflect the position of the WA government on coming in, that was a little over-focused on the deficit and overshot the mark in terms of its constraint on social program expenditure. The investment in the last budget will help ameliorate this problem, but it will take now time. So we set ourselves up for a problem with that social housing spend. And you can see here the numbers. So what we've done here is based ourselves at the start of the West Australian Alliance End Homelessness, and which is 2016, 2017. And we then look at every state and territory from that base. So we created an index series where you just divide each year's expenditure by the base year's expenditure, so and multiply by 100. So obviously you always start with 100 on that kind of index series. Where does WA look? Well, it's actually down here. It's a positive real increase. This is a real expenditure. So it actually is lower than the national and lower than every other state and territory. And unfortunately, the same story comes up in terms of social housing. Now it's not a real increase in homelessness expenditure. Now it's actually a big, real decrease in social housing expenditure. So whilst WA is at the bottom in terms of homelessness expenditure in real terms, it was a positive increase. But every other state and territory actually went further. When you look at social housing, it is actually a social housing decrease in real expenditure of 35%. So that's not a good look. Now, obviously, the big expenditure in the last budget that was historically high. There's no question about it. This commitment in the last budget and other announcements was historically big, but it's coming after a period of real decline, and I mean real decline. So we're using real dollars here, dollars 2020-21. So that's something to look at. Now, the last chapter of the report is agencies having their own voice, written by agencies. So we went out and said, tell us about your programs, because we want to write them up. And so agencies told us about their programs, and then they wrote, and we went back and said, is this your writing? Yes. So it's a real representation. I mean, obviously an agency had to engage in that process, but it is a big representation from an agency perspective of all the programs, preventative programs, the system-based housing, first initiatives, homelessness support programs that are identified, huge number that are spoken about. The system actually has a lot of great initiatives. When you read that chapter, it is that the overall spend and the housing affordability and housing, social housing factor is limiting our ability to move. Homelessness and healthcare, really significant initiatives, fantastic work that is being done. And assessment and referral programs. So some great work from Entry Point, for example, and the new Entry Point outreach, where we are seeing placements into the private rental market, which is fantastic to see. So have a look at that last chapter, and it provides a really interesting, rich insight into the service system responding to homelessness. Now, where do we need to go? Obviously, the housing factor is a really critical one as a systems response. We need to go back into prevention, understand all the preventative elements, a strong coordinated response, and we need data research and targets, which of course is what the Alliance is doing here today, and good collaborative efficacy. So I'll end it there. And now, John.
Well, thank you first, Paul, for presenting that information. Look, this data is very comprehensive. There's a lot of information in this report. It should be your go-to document if you want to know or understand what's happening in homelessness in Western Australia. it is the most comprehensive information that's been gathered together. Does it tell the whole story? No, there's still more to be added, but it is a good start, and it's a good way of, I guess, looking at what is happening in homelessness in Western Australia, and what is the data telling us, and what are we doing to respond. So there's a lot more work to be done, and we have formed an evaluation hub, which between the Alliance and CSI, we are meeting regularly to look at what is the data telling us, and doing some deeper dives into the information and responding. And so, yeah, so we're very appreciative of all the work that you've done, Paul, in pulling this information together. And I guess...
And the team.
And the team, of course. And none of this would happen without a team of researchers and students and staff in your centre. And so we're very appreciative and thankful for that. We know it's very confronting, and but we always said we would be accountable, that if we're going to end homelessness, we need to understand what is the data telling us, and we need to be accountable to responding to that data. And so this is our mechanism. This is the way that we look and understand and see what's happening, and then how we need to respond. So I encourage you all, including those on our online audience, to look and read the report. I know there's a lot of content in there, but there's something there for everyone, I'm sure. I'm sure that you would see your place, the work that you're doing, and how it would connect to the data. But so today is our opportunity to now respond and reflect to what we've seen and heard this morning. And we're going to have a bit of a panel session, and I'm inviting the online audience to share your reflections and also take the opportunity to ask questions and have a bit of a robust discussion and debate today about what we're seeing and where do we need to go. So on that basis, firstly, just put your hands together for Paul and his work.
And his team.
And the team. Leanne, do you want to put your hands up? Coco, Leanne. Thank you. And now I'll call on the panelists to come forward to, I guess, have a bit of a reflection and have a bit of a Q&A on the information in the report. And as I said to the online audience, please don't feel backward in coming forward, and go into the Q&A section and throw in your comments and questions. So I call on Zanella to join us, from CEO of Ruah, Leanne Strommen, who's the General Manager at Centrecare, Michelle, Mackenzie, CEO at Shelter WA, Alan Connolly, who's the co-chair of the West Australian Alliance to End Homelessness and the Lived Experience. And I think I'm the 5th panel member. Yes. And do you want to grab that mic, Paul? Just pull it off the thing. Or you want to hold it there?
I can. You hold the handheld mic.
No worries.
And I'll just.
Okay. All right. And I'll hand over to you to get into the Q&A.
So this panel session is not a session where everyone's prepared these long speeches. Well, I mean, you might have. If you have, give your speech. But it is going to be interactive. But I'm going to start off with one question to every single member of the panel, which is, what do we need to do to end homelessness? And in your response, not only talk in general terms, but really focus in on one thing. What is one initiative, one program, or in fact, one reform that you want to highlight in terms of an ending homelessness response? So yes, tell me, the audience as well, what you need or what we need to do to end homelessness, but then in your response, focus in on one thing. Who should I begin with? I mean, I can begin with John. You're at the end, and let's just go round. Let's just go round.
Okay. Well, the thing that jumps out for me, I guess, is the rate of homelessness amongst the Aboriginal Indigenous population in Western Australia. And when you think about the proportion of Aboriginal people in our community and the rates of homelessness, it exceeds any rate of any one cohort in Western Australia. And so for me, I think we really have some core work to do in terms of addressing homelessness amongst the Aboriginal and Indigenous people. And I think the first response really needs to look at how do we strengthen the Aboriginal controlled organisations to be in a position to be able to respond to their own countrymen and respond in an effective and in a well-resourced and a well, in a manner that gives them the capacity to be able to do that work. And I think we are starting to see some real signs, positive signs of moving in that direction, but we certainly have a long way to go. And I guess some of the examples would include the Muditch Maya program, which is a housing first support program for Aboriginal people being led by and run by the ACOs. You know, we've seen the Buraloo Bidi Maya and the Bula Mort responses being driven by some of the ACO organisations. Obviously, in terms of housing and housing being delivered by Aboriginal community organisations has still a long way to go. You know, if I think about Noongar Maya as being one of the community housing organisations, it's been in existence for 20 odd years, and over that time they've not really grown, they've not had capacity. And I know that Shelter is doing some great work in bringing those community housing organisations together to build their capacity to be in a position to grow as organisations. So there's a lot of work that needs to be done there. I think also in terms of cultural ways, when the Alliance and the state government announced their strategies and being underpinned by Housing First, the question then was, so how does Housing First apply within Aboriginal response to homelessness? And so we took the opportunity to engage with the ACOs to look at how do we form a cultural framework that Housing First could be applied. And so we went through an exercise with the Aboriginal community and the ACOs to say, how can your ways be translated within the Housing First framework? And I know that when that project kicked off, we asked Noongar Maya to, I guess, take the lead in that. But one of the things that they really struggled with was, well, how do we write this for all Aboriginal people when we can only talk about the Noongar people? And so we agreed that they could do this exercise within their own country, within their own language group, within their own cultural grouping, and so develop the Noongar framework for Housing First, which is fantastic. And they engaged elders and engaged their community and people with lived experience and developed the Housing First principles, or the Noongar Housing First principles. It's probably a national first and possibly one of the very few examples worldwide of developing a cultural framework for Housing First. So I think there's some of the real examples of how we need to build capacity across the ACOs. But I think we also need to look at, you know, when you said the prevalence of homelessness within regional communities, we need to now engage those ACOs within other regional areas within Western Australia, and how do we help support them and develop their capacity and their ways in terms of responding to homelessness. And so there's a lot more work to be done, but I think we've got some great examples and some great ways of showing that.
Great. Well, thanks, John. That's good.
I'm not quite there.
Oh, you're not quite there.
Just one more point. One more point.
Your speech. Yeah.
I think partnerships is going to be the key. I think the work that we can do as a sector and the community to help address things like endemic racism that is prevalent and that is driving much of the homelessness, that we need to be able to work in partnership with the ACOs. And again, there are many examples of that emerging, but I'm sure there's lots more work to be done.
Fantastic. Good, great work. And for those online, you can put questions and comments into chat. In fact, we're starting to see those already, aren't we? So, and we'll draw on those when we go into interactions after this round. So let's go to Deb. Deb Zanella.
I won't quite be as long as you, John. I think just though following on that, I think sort of stepping back, if I think about what we committed to in 2016, those targets, which we really had no idea whether we would achieve them or a mechanism, to see where we are now in terms of a system of evaluation and data is a significant reflection on the strength of our community services sector. And I think that's the thing that I would say is we have to keep doing what we have historically done and do more of it, which is actually collaborate as a sector and to not allow funding to drive divisive mechanisms amongst us. Because I think one of the things that I've been very clear around is that the department has a role as a commissioner, but it has not been in the place of service delivery and homelessness. So the IP rests with us as a sector and rests with people with lived experience. So I just think we have to continue to do that. The other key thing that I would say is that we actually require courage and steadfastness at this point of implementation. It is really, one thing is to imagine and to dream a system. The part of implementing a new system is really, really difficult. And I think we've just got to remain true to the evidence, and the body of evidence that's been developed over the last 10 years is really critical. And my third point is, and this is a message to our government colleagues, is that you have to fund equally in the critical space as you do in prevention. You can't do one or the other. We actually have to increase spending in prevention whilst we are reducing the inflow into tertiary services. And I think that's really critical. And my other last point is, I think in evidence from, obviously if sometimes the danger in data is creating groups, rough sleepers, couch sleeping, couch surfers, people in regional overcrowding, but effectively we're talking about people. And so, and we can, lobby our own cause, but ultimately at the end of the day, we're wanting people to have the best life. And so I think if we can just remind ourselves that data is critical, but it doesn't tell all of the story.
Mm.
Thanks, Deb, and great report, Paul and team. I also won't be talking as long as John. So I think it's a massive amount of work that everybody has undertaken, so really well done. First thing I'd like to say is in order to have true fidelity to housing first, we need a bipartisan approach, which I don't think is current. There also needs to be sufficient housing stock to meet the current demand. And we can't forget this is people that are homeless. And every time it's people that we're talking about that can't get access to a home. So I think that that's really important. The system is also at peaking point in terms of demand, and the stress levels on the people that are living on the streets and are at risk of homelessness is extremely high. And it doesn't matter whether it's a homeless service or an intensive family support service or a domestic family violence service, people are saying their housing is at risk. And it's really concerning that we find it really difficult to be able to do that. And this is people's ongoing experience on a daily basis. So we need to think about that. Getting to people quick enough is also an issue. And even with our new service, we know that we are not quickly getting to the service as fast as we would like to in the entry point outreach case management. As soon as you get to people, the better it is. You can help them quicker, and then you can perhaps meet the demand in a better way, and that people aren't getting their names on 50 different agencies, so we can't actually count who's actually homeless at this point in time. So I'd like to hand over now to Michelle before we come back to another question on a particular service later. So thank you.
Thanks, Leanne, and congratulations, Professor, on a wonderful report. We rock differently in WA, so our theme is housing, homelessness and health, but the National Homelessness Week theme is we need a national plan. So I think we need a national plan, National Housing and Homelessness Plan. We've got a great homelessness plan in WA. Not sure about the status of the WA housing plan. It's still a bit of a mystery. So we need a plan, and then within that plan, we need to harness all of our levers and all of the levers across government. So housing is a huge issue, and the government's got a number of policy issues at the state and federal level that it can bring to bear. Also the private sector, and also building on the strengths of the homeless service system. I'd like to give a shout out to housing. We need more homes, pretty obvious from your data, Professor Flatau, but also we've got a fantastic community housing sector here in WA, and we need to build on their strengths. We released a report showing the opportunities for using community housing to grow housing supply, not just social housing, but affordable housing and affordable rental housing. And we need to, as Deb said, stop, or maybe it was you, Leanne, stop segmenting things. Rental reform, we know people are in a huge rental stress. We've got a once in a lifetime opportunity to reform the Residential Tenancy Act. People are being evicted into homelessness. They can't pay rent. So let's make sure we've got good rental reform law in WA, the right homes in the right location, as John mentioned, culturally appropriate and managed homes. So building on the strengths of the Aboriginal community housing sector, but in general, building on the strengths of the fantastic community housing organisations across WA who provide professional property and tenancy management. They have really great ratios of tenants to staff, and they deliver better housing outcomes. So let's just get on with it. Thank you.
Thank you, Michelle. I make no apology for the fact that I probably don't speak politically correctly. I haven't been embedded in the sector for very long. My new role as the co-chair for the Alliance. So sometimes being honest is quite challenging, but at least the sector now has allowed myself, Trish, Debra, Josh, and other lived experience people to come into the sector and to understand the challenges that they are faced with, usually the F word, funding, and what we think is achievable from a lived experience perspective, knowing that, you know, just one more minute on the street for somebody who's rough sleeping is 1 minute too long. So I got to congratulate, I wouldn't have said this last year, but right now I've got to congratulate Paul, the team, the sector, the community, and starting to be the wider community as well, for probably coming together in this perfect storm that's occurred after the pandemic. And the saying is, you know, you can't manage what you don't measure. So we now have some accurate measurements. Could they be better? Of course they could. Everything can be improved, but we've got some starting points, and we can then build on those starting points. And if we have this collaborative effort, if we are bringing people with lived experience to actually engage with the sector, to be embedded with the sector, to maybe sometimes point out something that's not obvious to the sector, and continue to take that tiny step forward in providing more housing, and doing some things just a little bit better than are already being done. Because there is improvement, there's going to be massive improvement, again, when you have a concerted effort from the new Alliance team. And that has only been made possible because of the data and because of the collaboration for the sector. So I think we are on the road to ending homelessness. We just need to do more of it and just a little bit better.
Fantastic. Just before we go to the audience and online, so get your questions ready. We're going to do tag team between the physical audience and the online audience. Leanne, you mentioned that you were thinking about one particular service that you wanted to focus in on, just quickly.
So just in terms of entry point outreach, just want to reflect on that particular service that was started and funded by Lotteries West, and to try and get people who are in the private rental market at risk of losing their housing in the private rental market that may have never been at risk of homelessness before and or needed to get into the private rental market. Now, since it started in November, we've had 170 referrals, and we've had successful outcomes with 14 one-off interventions, 27 decreased barriers, 32 people housed in long-term accommodation, 30 self-accommodated and didn't need our support, which is really great as well. And we have still had to close the number of referrals that we can actually take, and that referral log has now closed at 7 weeks now. That's a really long time. It's a two-person service. People need more help to help other people, and already underfunded and under demand. And so it's really important. You really need to get to people in the first week or so to help them be able to move on. But it's had some fantastic outcomes to date with 2 people working with 170 people.
Good. And just to let people know, the next West Australian Alliance End Homelessness Evaluation Hub will look at measurement and evaluation with entry point and entry point outreach. So that will be led by Centrecare in the next one. So these are monthly or 6 weekly meetings that the Alliance, and if you're not a member of the Alliance, you really need to be. So just a bit of a plug that you need to join up. If you're a member of the audience physically or online, you do need to join up with the Alliance. And if you're interested in measurement and evaluation, come along to those meetings. Good. So now we can go to the audience. So we're going to go to the physical audience here. People I can see. And then Sarah's going to be highlighting 1 or 2 questions from the audience online. So who's got a question for the panel from the amazing group that are here today? Philippa? Co-chair of the West Australian Alliance to End Homelessness.
Probably my question's mostly for Paul, although there might be some reflections from the panel. Paul, I was really curious about the dip that you illustrated when COVID first hit in Western Australia in the Specialist Homelessness Services data.
Yep.
And your interpretation that that occurred because services had closed their doors. My understanding is that that occurred because most specialist homelessness services offering accommodation kept people in place to keep them safe during that time. And so the churn through services reduced substantially during that time. So less about the closing the doors and more about people having the opportunity to essentially sort of stay put. If that's the case, what does that mean from a data interpretation perspective about the patterns and trends in homelessness as far as you can see over the years?
Yeah, it's an interesting interpretation. So instead of saying we had, if you like, the same number who were experiencing homelessness, but they couldn't get support, so therefore the number fell. What you're saying is you didn't have those additional support periods, because we know that from the Sankey diagrams, the vast majority of those experiencing homelessness stay homeless at the end of their support periods, and so they churn in the system. It is an interesting interpretation, definitely something to look at. Now, if that's correct, and we weren't actually knocking people back, but we were in fact sustaining some housing, and therefore that's the reason for the dip. That suggests that we should really relook at that time period then, and say, well, what positively look at that time period and say, what can we learn? Interestingly, the gap, that dip is a relatively short period, and it is fundamentally linked to that April, May, June time period in 2020. It is a very significant change. So what we can positively learn, I think, from that time period is good. So some panel responses to that brilliant question.
Great question, Philippa. One of the things, and you probably know this better than me, is just the impact of the increase in JobKeeper on people experiencing homelessness and having adequate income support during that period. So I've heard services say, while it may not directly impact on your data pool that people were able to better manage their budgets and therefore not need service support?
Well, the JobKeeper took a little bit of time to come into play.
And the rental moratorium.
The rental moratorium is probably more fundamental, yeah.
Mine's a little bit different because I also wanted to point out that there was a decrease in domestic and family violence. I don't necessarily believe that that is correct. There was probably an increase in other services and it was underreported because people chose to stay in that environment or they couldn't get out and actually say that they were unsafe because it was COVID.
The data from police through that COVID period showed a 17% increase in FTV, whereas other criminal activity decreased or stayed the same.
Good. All right. So that's a nice start to this interactive panel section. Okay. So Sarah, what are we going to throw to the audience?
Thanks, Paul. Yeah, lots of great comments and questions coming through. Probably some granular data questions for you, Paul. There are 3, so I'll just put them in one. What can I, so one of them is the data broken down into winter versus summer? In terms of seasonal data. Also, is it broken down into local government area data? And the other last question is it broken down into regional statistics? Some of the commentary that's come through is that people want to act local in their local areas. So is there some more granular data?
Yes. So the granular data in terms of the monthly series, I mean, we can look at seasonality, you know, for example, do a seasonally adjusted series or a trend series. It won't change the story though. So winter now is a higher number than winter 3-4 years ago. Summer now is a higher number than 3 or 4 years ago. So even if we did that seasonal adjustment, and we'll have a look at that, it doesn't affect the overall trend. So the trend is up. So that's the first point. Yes, we can have a look at that seasonality, but we didn't. But the trend is there anyway. The question on the regional data, well, yes, we have done an analysis of the regional data, and that's where we say that the rates of homelessness and the support periods are higher in the Pilbara and the Kimberley. Now, some of that is severe overcrowding. If you look at the census data, true, and there's question marks about whether severe overcrowding should be in the homelessness data. I mean, there's been a big debate about that, but even aside from that, it's still higher. And so we do need to look at that. We can go into different regions. So we, at the SA4 level, we've got figures on Bunbury, Mandurah, etc. So yeah, we've done that. Local government, a little bit more difficult, not in the SHS data. You can do some work with the census, but not with the SHS data at that level in terms of the data that is available for us. I think that's all the questions. Okay, back to the physical audience. Who's got a question here?
Hang on, you need the mic, sorry.
The people that are recorded as having a disability, are they supported by NDIS plans?
Actually, I'll leave that to the actual agencies. I mean, the answer is that there is a proportion, but I would make the point that supported accommodation programs in terms of disability are much stronger than in terms of homelessness, much stronger. And we need to look at that. In fact, the disabilities supported accommodation and housing programs really do provide a bit of a template to say, well, why don't we have the same in terms of supported housing in homelessness? And there is an overlap, but.
Yeah, I don't know, but certainly in some of the by name list data, we can record whether people have a disability plan as a part of their care needs. But I don't think, certainly that's not, we don't have that granular data in the data that you provide, Paul, do we? No. And part of the difficulty, of course, is accessibility through the NDIS process, but also having case managers. I think the data that we've all sort of been speaking about a lot throughout the sector is a significant proportion of people who are experiencing homelessness don't have case managers, we don't have adequate support in order to assist people in navigating the NDIS system either.
Good. Fantastic. And Sarah, another question. Oh, sorry. Leanne was going to make a response on that.
Just going to say that we may collect that data on the clients that we service, but I can tell you that we had in the last reporting period for our Centrecare family accommodation service, 564 adults that were unassisted and 1,351 children which were unassisted. So there'd be a lot of people in that group that are at risk, and we can't tell you how many times they're not counted somewhere else or counted, and they would potentially have support plans needed.
Fantastic. Good.
I have a more of a cost benefit analysis type question from Just Home Margaret River. Do you have any data on a cost comparison for a person experiencing homelessness and all the services and supports they require directly related to that experience versus the provision of social housing as an overall cost to government, factoring in the 25% income revenue that would be received by the government?
Not in the advanced to zero data that we released today. We have done pretty elaborate cost benefit analyses in other contexts. In fact, the first analysis we did, the first piece of work actually on homelessness in West Australia that we did in, what is it now, 17 years ago, actually is the best piece of work doing that kind of analysis, where we actually took in the cost of capital. So we actually, it was an interesting exercise. We went to the Department of Housing and told us, we asked them to tell us what was the current market value of their dwelling. And we actually factored in the cost of capital, which wasn't actually very well done because we didn't have the proper data. So there are data limitations, but essentially in other work, we have examined what is the cost of capital for social housing, what is the actual support for social housing, and compared that with the cost of homelessness and the cost of support in terms of homelessness. And typically the cost benefit ratios are pretty strong in terms of transitioning into housing as a more cost effective way of approaching this. And you can start to see that with cost offset numbers, which are pretty high. I mean, the advanced to zero numbers are actual cost numbers, not necessarily cost offset numbers, but examples of this, the higher the need, the greater is the cost offset. So when we did the linked administrative data exercise, people going into public housing, particularly with significant mental health support, including residential mental health, that saving was something what was $12, $13 million from a program of 100 odd people. The higher the level of need, the greater typically is the cost offset by transition into public housing. All right, so yeah.
Can I just make a reflection? So you're absolutely right, Just Home. The economics, as Professor Flatau said, stack up in terms of the benefit of providing housing and support VRV, people living on the street, which gets back to one of the what do we need to do to end homelessness, and it's having the community outrage. So the economic arguments all stack up, but who cares? No one seems to care. Treasury don't seem to care. The government don't seem to care because they haven't reinvested their budget in terms of where it makes sense in terms of the economics. So I think that's where one of the key things and the beauty of the Alliance is mobilising the community to say enough is enough. It's wasting money, it's destroying people's lives, it's not pigeonholed in terms of those people who sleep on the streets, it's affecting young people, families, grandparents. The whole community is impacted by this as the cost of living goes nuts. And so we need the community to actually say to government, there are votes in it. Please do something and reinvest money in the right way. And until the community has that message to government, things aren't going to change. So that's a key thing, I think.
When you say governments and policymakers don't care about these kinds of numbers, that's not necessarily the case. You know, when you look around Australia. So let's just give let's just give a couple of illustrations of that. Yesterday in South Australia, with Flinders, we launched the Aspire Social Impact Bond evaluation. In South Australia, Treasury and Finance was the department, along with Housing, that was the most engaged in the social impact bond. Now, Aspire is the first homelessness social impact bond. It's Treasury and Finance in South Australia that really were fascinated by this. And of course, the social impact bond, the Aspire social impact bond, had performance criteria related to cost offsets. Likewise, when we did the Journey Social Inclusion in Melbourne, it is Treasury and Finance that were really engaged in that. So around Australia, Treasury and Finance have been really interested in this, and the social impact bond Aspire evaluation is going into Treasury departments all around Australia. So, yeah, no, I mean,
I take your point. So there are pockets of excellence. So I mean, in a systemic way. And that's where I think, you know, it's fantastic at the national level, the case is being prosecuted for a national housing and homelessness plan. So all of these levers can be embedded and not just have these fabulous staff who might drive an agenda within a government department. It's a systemic approach. And yeah, the WA government's doing some great things, but when you look at the economics, as Just Home pointed out, so much more could be done because it makes economic sense. But it's the social outrage that's needed to support government to do the right thing.
And by the way, the Australian Alliance to End Homelessness, of which the West Australian Alliance is part, with us put out this really important report, Ending Homelessness in Australia, last year. So we actually have the full-blown plan. It's all there. That was launched at the beginning of this year. So, yeah.
So I know that we're almost coming to a close, and every year we have Homelessness Week, and we have all of this activity. And what is really going to change in Western Australia is if we keep the pressure on. And the pressure has to obviously come from the sector, but it has to be driven by the community. So I'm asking you to reach out to your friends and family, and I'm asking you to try and get them to engage in whom they think might be at risk of homelessness. Because believe you me, when I became homeless, my family weren't aware how dire my situation was. And I was too afraid to ask. So please keep the pressure on. And that's, I know, going to happen with the Alliance. I know that's going to happen with Shelter. But the real pressure comes when there's community will. And community will means that you can all in this room reach out to somebody and extend that community will. So thank you.
Good. Okay, question from the audience. Alternatively, question online, of which there are many, and they're very detailed, I must say.
Sorry, I've been away from this. Did the decrease in the need for services also align with the time where Centrelink payments doubled?
Are you're talking about the COVID decrease?
There's no context. It's.
I think that's what. Yes. So who wants to answer that? We have answered that. A dominant answer from the panel to that question. So another question from the audience.
How would you all like your evidence in this dashboard to be used by decision makers? Because it's brilliant work. Is there a gap getting it to decision makers, and how are you briefing decision makers with this work? It's, yeah, to the panel, how should we be using this?
Well, we do tell policymakers about this. We send, so all the policymakers in West Australia have a copy now, or have access to the dashboard. have the report. So yes, they've been told. But your interactions with policymakers around evidence and use of evidence. And so on.
Evidence is only one part of the formula that convinces government to do something. I think there's, political will and the political drivers at the time. So if I just think from a Ruah perspective and the collaboration of the sector in the 50 Lives story, that was after many years of evidence, but equally an amount of time where we advocated and where, to Michelle and to Alan's point, we collectively came together to drive. So I think you can't have one without those other two components. I think data or evidence on itself, I think we have enough evidence that doesn't necessarily shift government to fund stuff, but where you have enough movement, whether that's from the broader community, a particular element of the sector or the broader community, coupled with smart timing in terms of the political cycle, I think that is the equation. So I think you've got to keep on about the data, you've got to keep on about the evidence, but you have to invest equally in those other components as well.
And I think be brave. So if I think about Debra and Ruah and what they've gone through in terms of the city of Perth, the evidence is compelling. But call it respectfully and say, look, the evidence shows X, so there might be a whole lot of reasons why you're not wanting to pursue the evidence. So let's sit down and understand why, and then work it through in a really respectful and outcome focused way, and not just go with the talk back kind of hyperbole hype where decision makers might get spooked. And that gets back to, again, community being equipped and saying, no, actually, we're a community, we're inclusive, we're diverse, and all people have a right to be in our communities.
It's not the people who attend most of these meetings that it's important to get to. There's no good as keep preaching to the converted. It's the silent people that we need to get to. They are the majority. You normally find that a meeting or a workshop can be hijacked by those who've got a specific interest. But when we get to the general community, and that's something that I do on a twice monthly basis, I actually go in, I listen to what the community is saying, and they're saying that they have 2 to 3 bedrooms at home that they would gladly let people use, providing there were some sureties, providing it didn't affect their pensions. So, we just need to understand better what the community wants. And they are the silent majority, I can assure you.
Just make a comment that, whilst I said what I said, the exception to that rule, which I hope becomes the more dominant stream, if I think about the Sisters of St John of God, who have clearly listened to evidence and funded significantly in the homelessness space, and in fact, who sponsored this report, who sponsored the Alliance. And I would hope that, there's an increasing rise in those kinds of funders, actually.
Yeah, and we actually make a specific point about acknowledging the Sisters of St John of God in terms of the funding of this dashboard and the report. So very, very important work. I might say just...
can I just make one point? The power of narrative and the dominant narrative that exists in our community, we need to use the evidence to change the narrative. We talk about the making, rent fair campaign and, the opportunity to reform rental, make rental reform. We have to put out a different narrative and use evidence to back that, because otherwise nothing changes. And so part of using evidence is to shift and change the narrative. And if I reflect back 5 years ago, there was very little narrative around we can end homelessness. Now it's the dominant narrative. The challenge obviously is how do we go about doing that and achieving that? But the thing is the power of narrative. And so evidence is an important aspect of shifting the community dialogue and the community narrative. We still have a lot more work to do, but we now also have some evidence to help shape that narrative.
Yeah, good. I was just going to make the point that we are getting good access sometimes to policymakers and to ministers. So, for example, with the Funding of Homelessness Services report, Minister Carey wanted a briefing, and he got a briefing, and he was most interested in the tables and tables and tables of stats. He wanted to know what this data meant, and that was the part that he was most interested in. So it was good to be able to go direct dialogue with the minister and say, yeah, this is new data. This is coming from the services around the funding of homelessness services. You know, it's a great piece of work on the funding side of homelessness services. And he was really interested in that data and said he'd take it on the plane and read further. So in his meeting that he was going to. So we do get in there. We do get in there.
I would also like to extend to a number of people, including just make a comment around Entry Point Perth and the demand that that particular service has had over the years, and the number of times that we invite government or other players to come and listen and come and join that story in that room, and what the pressure feels like in that. And we still find it really difficult for people to come and listen. So there is evidence there, and there are invitations there that are still not being met. So that's an invitation we clearly give to other parties in this room and in the audience.
Good.
I just want to riff off Paul. So the Funding of Homelessness Services showed a 13% the sustainable funding of services is not there, and there's a 13% gap between the need of current services and the demand. And Minister Carey was really receptive to the briefing, and I think what it showed was the power of evidence. So there was no hyperbole. Services did a brilliant job. He's the evidence minister, and I think the task for us is to equip the minister with the evidence that will enable him to prosecute a case within government to increase investment. So evidence is critical. We've done the same with the rental reform. So Ruah have got a piece of research in the field. We've had it critiqued by eminent housing researchers. Again, no hyperbole. Well, this is the reality. And I think if you can sometimes take the emotion out and just say, look, here are the facts. The outcome we want is great housing outcomes for everybody. The evidence is really, really powerful, but also coupled with the stories such as ours. So stats are stats, but when you can see the impact on people's lives, that's important too. But the evidence is critical, and you can cook the books, and not cooking the books is very important if you want to have an argument that can win the day. Yes. Not that you'd ever cook the books, Paul.
No. We must also always be truthful. You know, we never cook books. It's always good to be very transparent and accountable on data. Now, we know that there is morning tea waiting. And so let's have one final question, whether it is from the audience here or online, doesn't matter which one it is. One final question. Oh, yes. Tony?
Paul, does the report identify how much money would be required to meet the need that you identified? In terms of, for example, how many houses over what period of time? Is there an opportunity to begin to set targets for this state rather than to simply talk about the possibility? I mean, when we're looking at Victoria putting billions of dollars into social housing over a 10-year period, here we're talking about a few $100 million, and the data you showed in terms of the graph shows us exactly why we are where we are. Have you identified the possibility of just what numbers we're actually talking about?
No, there was some interesting work though that was done, just saying what would be the required dollar investment by some of the researchers at UNSW. Now, we haven't done that in this report in this case. So what we can do is actually have a look at that question, because they did ask the question, if we were to be able to meet that housing need, what would the investment look like? And it's really interesting to ask the question of this big social housing package that the government came up with. How much of it is simply looking at the past and getting us back to sort of parity from the past, given that 35% decline.
We want to get beyond that, mate. No, we don't want to get parity.
No, I'm just saying, it's an interesting question.
Yeah.
to examine, to say, what would we need to spend to be able to get not parity from the past, but to meet the current need? And yeah, there was an interesting exercise. So we will have a look at that. No, it wasn't in this report.
It's important for targets. We shy away,
Yeah.
in this state, we shied away setting targets at a state level for at least 20 years that I'm aware of. But that might help actually then gauge how we're traveling, because we don't have a clear target. And I think, yes, there are people putting a bit of money into this, but we're talking about billions of dollars. We're not going to resolve homelessness by the odd sort of entrepreneur give us a few $1 million. So I think that work would be really helpful.
Yeah, I mean, it's a very interesting piece of work. And obviously what we have been saying for some time now is that at the national level, we need this boost to the National Housing and Homelessness Agreement. And one of the consequences of the Australian government putting in more money is that on the homelessness support side, the West Australian government would have to move very significantly. So at the moment, the West Australian government is spending a little bit more than its required 50%. So, it has to match the Australian government NAHA allocation to Western Australia, which is something like 47 million or whatever it is. But the West Australian government spend is not that much higher in homelessness support or homelessness services than is required on a 50-50 match from the National Housing and Homelessness Agreement. So if the Australian government pushes up, the West Australian government would have to push up with it, which is an interesting proposition. That's why you do need to focus on the Australian government NAHA allocations.
Okay, but we've got a few $100 billion in the bank. We could spend a bit more money here anyway.
Yeah, well, obviously that austerity program overshot its mark. And that's the West Australian government came in late on its social housing investment, no question about it.
I was just going to say the NAHA review, the NAHA finishes next year, and the Productivity Commission's done a review into the National Housing and Homeless Agreement. We've got a new government, and so the time is now to prosecute the case for an increased uplift in the NAHA, not just in the homelessness services, but in the housing allocation to the states, because it's a partnership agreement. And my understanding is that because we've got a new government, the NAHA might be rolled over for a year, which gives us an ample opportunity to prosecute a case within a year for increased funding. So that's where the national peaks are really important, working with the state peaks and the evidence is critical.
Yeah, I mean, you do have to remember that Rudd came in with a big plan and delivered. And if you look at the first Housing First programs, particularly say Sydney, with for example, Misha. Misha was a Housing First program that was delivered at the same time as that significant global financial crisis stimulus package. And you were looking at people being able to move into new homes as well as some existing public housing placements at that time, making that Housing First program much more able to meet the demand of chronic homelessness, particularly in Parramatta at the time. So that's very, very important.
Just in answer to that as well, you've got to be aware of capacity. So who in the room at the moment is engaging with any tradies? We're trying to get a tradie to come and give you a quote. Is it easy? Are the prices good? No. So we have to have capacity as well, and that is more of a planning, a longer term strategy, and not just being reactive. So, and it has to be aligned, like Paul said, if the federal are going to put in more, then the state can put in more. But we need to be training apprentices. We need to be making sure that the employment opportunities follow that demand for housing. Otherwise, we're just going to create more unaffordability. Just my perspective.
Good. Okay, well, I think we can wrap up, John.
Yeah.
because everyone is very keen to get stuck into that morning tea that they can see over there.
Well, I certainly want to thank the online audience for your participation and questions and interest, and obviously from the audience here today. Put your hands together for the panel and for Paul and his team. And we actually have gifts for people as a small thank you.
Oh, thank you. Another report. Oh, there's something else there. So good.
I think Michelle, ours comes later. All right, and just to conclude, just want to obviously acknowledge our sponsors for this week. And please go to the Shelter WA website and have a look at all the other activities that are still on for this week. There are activities happening right throughout, and feel free to register. But would like to obviously mention thank you to our sponsors in Lottery West, Department of Communities, Fleetwood, Beyond Bank and Uniting Church in the City. Thank you for your participation this morning. I'm sure we could continue the dialogue as we break over refreshments, and thank you for your participation.
Thanks, Bob. That was great.